Cataracts are one of the leading causes of vision impairment in Australia. So to help make the matter clearer for us today and to provide some insight on our eyesight, I am joined by ophthalmologist Dr Chandrabala. Welcome to the show.
Good morning, Paul. Thank you for having me.
Of course. So I just found out that cataracts are common in Australia. But firstly, what is a cataract?
A cataract is a cloudy lens in the eye. So if you look in the mirror, you see your colored part, which is your iris. Behind it, hidden from your view, is another window. When it gets cloudy, that's a cataract. And that cataract prevents light from reaching the back of the eye.
Okay, interesting. So how do cataracts occur?
Cataracts occur when the protein in the lens breaks down. It is a completely normal and natural part of aging, and it's especially common if you're over the age of 60.
Right. So when you say impaired vision, what sort of symptoms are commonly experienced with cataracts?
So the cloudy window stops the light going in, so things look blurry. You may even get a bit of double vision.
Right.
You may find sensitivity to light and glare. And some people notice that their glasses need to be upgraded every 6 months.
Sure.
It's important to remember that these symptoms can also happen due to other conditions. So you really need to be not making a self-diagnosis but seeing your eye specialist.
Well, I believe we have some visuals to help us better understand the experience of having some of those symptoms you just mentioned.
Yes, we do. So let's take a quick look. Here you can see a simulation of what cataracts can do to your vision. The image shows that the vision is getting blurry, there's a little bit of doubling, and the colors are appearing to fade,
right,
which most people will not recognize until they've had the cataract fixed.
Okay, all right. So how do cataracts impact the patients who have them?
Cataracts usually develop slowly. Some symptoms might go unnoticed in the early stages.
Right.
You might be updating your glasses frequently, you might need brighter lighting, and sometimes it'll start impacting the quality of life by, say, stopping you from driving at night, or you might even give up on reading. Add to that, if you are elderly or your loved ones have dementia, then the sensory deprivation can really confuse the individual.
Sure.
The cataracts are unfortunately not going to get better on their own. But the good news is there is surgery available that can restore visual impairment, and you really must go and see your eye doctor.
Okay, so tell us about the surgery. I'm sure people want to know more about that.
Once you go and see your eye specialist will determine if the surgery is suitable for you. And it is one of the commonest performed surgeries in this country.
Right.
The surgery will involve removing that cloudy window and replacing it with an artificial lens, which we call an intraocular lens or an IOL.
Okay, so what should patients consider before having cataract surgery?
Well, it isn't just about removing the cloudy lens. It's an opportunity to potentially reduce your need for glasses.
Great.
And this is where the type of intraocular lens that is replaced in the eye matters. And it's not a one-size-fits-all approach. Lens selection is personal and should align with the patient's goal.
Yes.
An eye care specialist will be asked and will hopefully go through the options in detail with their patients to find the best outcome for them.
Oh, it's really fantastic to know there is potential to do something about cataracts, Doctor. What would you say to viewers who think they, or even perhaps their loved ones, may be experiencing cataract symptoms?
The old adage applies, a stitch in time saves 9. If you have symptoms that are affecting your eyesight, don't wait. Go see your GP or your optometrist and get a referral from them to see an eye specialist.
Absolutely. Well, thank you for sharing your insights with us today, Dr. Bala. We're all a bit clearer on cataracts now and comforted to know that there are treatment options available.
It's been a pleasure. Thanks for having me, Paul.